Done, thanks, I'm finished. If you finish even before you begin, you might have a problem. Premature ejaculation is a fairly common sexual problem, but one that's rarely discussed openly. Why? Well, the truth is, it's normal for anyone to be embarrassed about something like this, so I know you'd never talk about it with a friend at a dinner party or during casual conversation, but you absolutely should talk about it with your doctor, because there are ways to solve the problem, and today, I'm going to explain them to you in detail. I'm Dr. Melani Rubio, a urologist with over 10 years of experience specializing in male sexual health, and in this video, you'll learn everything you need to know about premature ejaculation, the underlying causes, available treatments, practical tools to control it, and even, in some cases, strategies to get rid of it once and for all. This is information that can genuinely transform your intimate life and restore confidence you may have lost. Premature ejaculation is one of those topics you've definitely heard about at some point in your life, perhaps in a movie, a joke, or whispered conversations. But you probably don't know anyone who openly admits to suffering from it. The reality is that up to 1 in 3 people acknowledge having experienced it at some point in their lives, which means it's far more common than most men realize. The silence around this issue creates unnecessary shame and prevents men from seeking the help that's readily available. Keep in mind also that you need to align expectations properly. If your partner wants you to last 70 minutes and you lasted 25 minutes, of course you don't have any problem. That's not premature ejaculation. That's actually well within the normal range. In fact, studies show that the average time for intercourse is somewhere between 5 and 7 minutes, which surprises many people who have been influenced by unrealistic portrayals in media and adult content. The medical definition of premature ejaculation is when the release of semen from the body, that is, ejaculation, occurs before time or earlier than desired during sexual intercourse. But what does before time actually mean? This is where clinical criteria become important. First of all, it shouldn't be a cause for concern if it doesn't happen to you often. An occasional episode of finishing quickly, especially if you're very excited, haven't been intimate in a while, or are with a new partner, is completely normal and doesn't constitute a medical condition. But if we're going to talk about a proper diagnosis, there are some specific things to consider before believing you suffer from the problem. Number 1, if you always or almost always ejaculate within 1 to 3 minutes after beginning penetration. I'm not talking about foreplay, kissing, or other intimate activities, but specifically the act of penetration itself. This consistently short duration is one of the primary diagnostic criteria. Number 2, if you never or almost never can delay ejaculation during intercourse, meaning you have little to no voluntary control over when ejaculation occurs. This lack of control is a key distinguishing factor. Some men can recognize the sensations that precede ejaculation and can modulate their arousal, while others feel the process is completely beyond their control. Number 3, if it frustrates you significantly or embarrasses you deeply, and as a consequence, you tend to avoid intimacy with anyone, or you experience anxiety before sexual encounters, or your relationship is suffering because of this issue, well then, there's a problem that deserves attention and treatment. But a fairly common question that patients ask me is whether you're born with premature ejaculation, or is it a medical condition that develops? The answer is actually both are possible. There are 2 main types of premature ejaculation: lifelong, which means you've experienced it since your first sexual experiences, and acquired, which means it developed later after a period of normal sexual function. There are some medical conditions that can contribute to the problem of premature ejaculation. For example, inflammation of the prostate, also called prostatitis, which can create heightened sensitivity and urgency. A rapid drop in your testosterone levels, which can affect sexual function in multiple ways. An increase in estrogen levels relative to testosterone, creating hormonal imbalance. Thyroid problems, both hyperthyroidism and hypothyroidism. Even erectile dysfunction could also cause you to have premature ejaculation, because if you're worried about losing your erection, you may rush to ejaculate before that happens, creating a self-reinforcing cycle. If it's a medical condition that's causing the problem, like acute or chronic inflammation of the prostate or a hormonal imbalance, there are specific treatments that can be used to address the underlying cause, and you should see a urologist to know the specific treatment you require. Blood tests can check hormone levels, physical examination can assess prostate health, and a detailed medical history can identify other contributing factors. Now, if you were born with premature ejaculation, meaning you've experienced it since your very first sexual encounters, there's probably a hypersensitivity in the specific parts of the penis responsible for generating pleasure and that lead to ejaculation. These highly sensitive areas include the frenulum, that small band of tissue on the underside of the penis connecting the glans to the shaft, the corona, which is the ridge around the base of the glans itself, and the underside of the shaft. Some men are simply born with more nerve endings in these areas, or with nerves that are more sensitive to stimulation. But don't worry, there are also effective ways to reduce that hypersensitivity, so you feel more comfortable and confident and can also last longer in any type of sexual relationship. The goal isn't to eliminate sensation entirely, which would defeat the purpose of intimacy, but rather to modulate it to a level where you can enjoy the experience while maintaining control. What can be done to decrease that hypersensitivity? That's the question that's going through your head right now. So let's start with what could work for most people. I'm going to organize these from the simplest, least invasive approaches to the more involved medical interventions. The use of a condom. This is often the first recommendation I make because it's simple, accessible, and has the added benefit of providing protection against sexually transmitted infections and unintended pregnancy. A condom means there won't be direct skin-to-skin contact. Therefore, it reduces the sensitivity of the penis by creating a physical barrier. Some people even say they'll last double the time when using a condom, if you're still not happy because you want it to be more than 4 minutes. Or if you're in a long-term relationship where condoms aren't necessary for other reasons, don't worry. There are additional options. We doctors use lidocaine, a local anesthetic, when we're going to suture a wound, for example, so the patient doesn't feel pain during the procedure. Well, there are creams, gels, or sprays containing lidocaine or prilocaine that you can use to decrease hypersensitivity by applying it to the glands in the lower part of the penis, especially focusing on that highly sensitive frenulum area. These products are available over the counter in many countries. Here's the important part. We apply it about 10 to 20 minutes before intercourse to allow it time to work, and then prior to the act, we clean it well with a damp cloth. Otherwise, you'll end up anesthetizing and reducing your partner's sensitivity too, and you definitely don't want that to happen. Some products come in a spray form that dries quickly and transfers less to a partner, which can be more convenient. Just as the dose makes the poison. As we say in medicine, in this case, position can play an important role in how much stimulation you receive. The more friction there is on the lower part of the penis, particularly on the frenulum and the underside of the shaft, the more likely you are to ejaculate quickly, since that's where the majority of the sensory nerve fibers that predispose you to ejaculate are concentrated. Therefore, choose a position where there isn't as much friction on the base and underside. For example, positions where your partner is on top allow them to control the pace and depth, and there's often less friction on the most sensitive areas. Side-by-side positions can also provide less intense stimulation. Experiment with your partner to find what works best for both of you. The traffic light method, also called the stop-start technique, also works for most people and has been studied extensively in sexual medicine. Here's how it works. You advance and advance with your normal rhythm, and when you feel that sensation building, that point where you recognize you're approaching the point of no return, it's as if the light changed to red and you stop advancing completely. You remain still, or you can even withdraw partially. Between 10 and 30 seconds of this pause is what allows your body to readjust or reaccommodate, letting the arousal level decrease slightly, and then you can continue again with stimulation until you feel that ejaculation reflex building again and you stop again. You can repeat this cycle multiple times during a single encounter, And over time, many men find they develop better awareness of their arousal levels and better control. Obviously, apply this method with your stable partner, and it should be something you've previously discussed openly. Otherwise, it's going to be quite weird and potentially frustrating if out of nowhere you stay completely still without explanation. Communication is absolutely key here. Frame it as something you're doing together to enhance both of your experiences. There are several medications with different mechanisms of action that have been studied for premature ejaculation. Some antidepressants, particularly selective serotonin reuptake inhibitors or SSRIs, have a side effect of delayed ejaculation, and this side effect can be used therapeutically. Medications like sertraline, paroxetine, or fluoxetine can be taken daily or a few hours before intercourse. There are also medications like tramadol that can delay ejaculation. However, it's preferable that you work on the behavioral and physical points mentioned above first, and also work on your breathing patterns and relaxation techniques, and you'll probably have good results without needing to introduce medications with their potential side effects. All of these approaches, as you can see, have been non-invasive methods. They don't require any type of surgical procedure or injections. Even something classic that many men instinctively do is think about anything else that has nothing to do with what's happening at the moment to decrease the reflex and distract from the intense sensations. Some men think about work, about sports statistics, about anything non-arousing. That mental distraction technique also works for some people, though I generally recommend the stop-start method is more effective. Let me also talk about breathing, because this is something many men overlook. When you're aroused and approaching ejaculation, your breathing often becomes rapid and shallow, which is part of the sympathetic nervous system activation. If you can consciously slow your breathing, taking deep breaths from your diaphragm, you can activate the parasympathetic nervous system, which has a calming effect and can help delay ejaculation. This takes practice, but can be remarkably effective. Pelvic floor exercises, commonly known as Kegel exercises, can also help. Many people think Kegels are only for women, but men can benefit enormously. By strengthening the pelvic floor muscles, you can learn to contract them at the moment you feel ejaculation approaching, which can help delay it. To find these muscles, try stopping your urine stream mid-flow. Those are the muscles you want to exercise. Practice contracting them for 3 to 5 seconds, then relaxing for 3 to 5 seconds, and repeat this 10 to 15 times, several times per day. Now, if we're going to talk about medical procedures for men who haven't found success with the methods above, there are some options. Circumcision can reduce hypersensitivity since it exposes the glans to more friction constantly, day in and day out against clothing. Therefore, you'd be more accustomed to stimulation, and the glans becomes less sensitive over time. Some studies have shown that circumcised men, on average, last slightly longer than uncircumcised men, though this is certainly not true for everyone, and the difference is modest. Hyaluronic acid injection is also used for this purpose. This product is better known for penile augmentation or enlargement procedures, but it can also be used specifically to reduce hypersensitivity by injecting it beneath the skin at the base of the penis and along the shaft. This increases the distance between the skin surface where stimulation occurs and the nerves beneath, therefore creating less direct nerve stimulation and less sensitivity. The effects typically last 12 to 18 months before the hyaluronic acid is naturally absorbed by the body. There's also a newer procedure involving selective dorsal neurectomy, which involves cutting some of the nerves that provide sensation to the penis. This is obviously the most invasive option, and should only be considered after all other approaches have failed, as it permanently alters sensation. Let's also talk about the psychological component. Because premature ejaculation isn't always purely physical, performance anxiety is a huge factor for many men. If you've experienced premature ejaculation once or twice, you may become anxious about it happening again. That anxiety itself can trigger the sympathetic nervous system, which actually makes premature ejaculation more likely. It becomes a self-fulfilling prophecy. Working with a sex therapist or counselor who specializes in sexual issues can be incredibly helpful. They can provide cognitive behavioral therapy techniques to manage anxiety, help you reframe your thoughts about sexual performance, and work with you and your partner together to improve communication and reduce pressure. Many couples also benefit from sensate focus exercises, a technique developed by sex researchers Masters and Johnson. These exercises involve taking penetration off the table entirely for a period of time, and instead focusing on touching, exploring each other's bodies, and learning what feels good without the pressure of performance. This removes anxiety and allows you to rebuild positive sexual experiences gradually. It's also worth discussing masturbation habits. Some men who masturbate quickly, perhaps because they learned to do so rapidly in adolescence to avoid being caught, train their bodies to ejaculate quickly. If this sounds like you, try practicing the stop-start technique during masturbation. Take your time, go slowly, stop when you feel arousal building, and practice lasting 10, 15, or 20 minutes. This solo practice can translate to better control with a partner. Another factor that's often overlooked is the refractory period. Many younger men find that they have better control during a second round of intercourse because they're less sensitive after having already ejaculated once. If premature ejaculation is an issue, you might consider ejaculating before your planned intimate encounter, either through masturbation a few hours before or through a first round of quick intercourse followed by other intimate activities while you recover, then a second round where you'll likely have much better control. The frequency of sexual activity also matters. Men who are sexually active more regularly often have better control than men who have sex infrequently. If you only have intimate encounters once every few weeks or months, you're likely to be more excited and more prone to premature ejaculation. More regular sexual activity can help normalize your arousal response. Let me also address the impact this has on relationships, because that's often what brings men to my office. They're concerned about disappointing their partner, or they've received complaints, or they sense frustration. First, I want you to know that penetrative sex lasting a long time is not the only way, or even the primary way, that many partners experience pleasure and satisfaction. Many women, for example, do not reach orgasm from penetration alone, regardless of duration. This means that focusing solely on lasting longer during penetration may be missing the point. Instead, focus on being a generous, attentive, communicative partner. Use your hands, your mouth, toys if appropriate, and take time with foreplay. Make sure your partner is satisfied whether or not you have control over your ejaculation timing. When you remove the pressure and expectation, you'll likely find that your control actually improves naturally. Communication with your partner is absolutely essential. Don't suffer in silence or avoid intimacy out of embarrassment. Talk openly about what you're experiencing, what you're trying to improve, and how you can work on this together. Most partners are understanding and supportive when they understand what's happening. They may have suggestions, may be willing to try the stop-start method with you, may be open to positions that provide less stimulation, or may simply reassure you that it's not as big a deal as you think it is. As you've been able to see, fortunately, premature ejaculation is a condition that can be treated effectively in the vast majority of cases. There are medications available with proven efficacy, psychological factors that can be modified through therapy and practice, and practical techniques to delay ejaculation that can help you enjoy and improve intercourse, both for you and your partner. The most important thing is not to suffer in silence or let embarrassment prevent you from seeking help. Premature ejaculation is a common medical condition, not a character flaw or something to be ashamed of. Urologists and sex therapists deal with this issue every single day. We've heard it all, and we have solutions that work. If you take nothing else from this video, remember this: you are not alone. This is treatable. You can improve. It may take some trial and error to find what works best for you, but the vast majority of men who actively work on this issue see significant improvement. Start with the simple interventions, using condoms, trying the stop-start technique, practicing pelvic floor exercises, managing anxiety through breathing and relaxation. If those don't provide enough improvement, consider topical anesthetics. If you're still struggling, see a urologist who can evaluate for underlying medical causes and discuss medication options or procedures if appropriate. Your sexual health is an important part of your overall health and well-being, and you deserve to feel confident and satisfied in your intimate life. Don't let premature ejaculation rob you of that. If this video helped you, if you learned something valuable, or if you feel more hopeful about addressing this issue, please don't forget to leave your like. Comment below with any questions or your own experiences. If you're comfortable sharing, and share this video with someone who might benefit from this information. For more daily health content, evidence-based medical information, and topics that matter to your well-being, you can find me on Instagram and TikTok. I regularly post shorter videos, answer questions, and provide updates on the latest research in urology and sexual health. Thank you so much for watching, and remember, seeking help is a sign of strength, not weakness. I'll see you in the next video, where we'll continue discussing important health topics that affect your quality of life.